Borderline personality disorder. BPD is a mental illness that alters one's thoughts and feelings towards themselves and others. It commonly works alongside other mental illnesses such as anxiety, depression, substance abuse, and other personality disorders. There are various symptoms that may occur with BPD, some of which include changed self-image, unstable relationships where they may love the person one second then hate them the next, heightened emotions where they cannot deal with anger, fear of abandonment. People with BPD will not put themselves in situations where they will be left alone. Mood swings can last anywhere from a couple of hours to a couple of days, and they may have impulsive urges such as binge eating and shopping sprees. Disfigured image of the self, self-harm and suicidal thoughts, paranoia, and out-of-body experiences where they may feel unattached to the physical body. What causes BPD? There is no clear cause for BPD, but there are some ideas. One idea is that genetics can be a factor into this mental illness. Mental illness can be hereditary, but it is difficult to say whether the child shows symptoms because of genetics or because of behaviors children have picked up from their parents. Another possible cause could be childhood experiences. Some experiences that a child might go through that would factor into BPD are severe stress or fear, family instability, abuse or neglect, loss of a family member. It is hard to diagnose children with BPD because their personalities and emotions are still growing and developing. The last idea is the brain. Serotonin is a chemical in the brain that deals with emotion. If serotonin does not function properly, it can lead to aggression and impulsiveness. Diagnosis for BPD is commonly missed, and if this is the case, it can drastically delay rehabilitation. Also, BPD is commonly misdiagnosed for bipolar disorder. The difference is bipolar mood swings can last from weeks to even months at a time. BPD mood swings are much shorter. It is hard to diagnose children with BPD because of the fact that people diagnosed with BPD cannot hold a steady relationship. Their office, intimate, family, friends, and social life will be impacted. A parent with BPD will grow so attached to their child that even simple tasks like their child going out with friends will feel like a great betrayal to the parent. It may even get to the point when a parent will detest one child but adore the other. Although it is possible for this diagnosis to get better with age. The mentality is, you are either with me or against me. The first form of treatment is DBT, which focuses on current emotions and how to control them. Next is mentalization, which helps one understand the feelings and thoughts of others. Transference-focused therapy gives the patient insights that they can use in everyday life. Good psychiatric management. Although medication does not provide a cure, it certainly does help. And self-care activities such as exercising, eating well, and getting enough sleep. Thank you for listening to my presentation on borderline personality disorder.